Hello, everybody. Welcome back to Healthcare Experience Matters. Joining us today is Shawn Rossi. She's the VP of Communication and Member Engagement with the Mississippi Hospital Association. Welcome to the show, Shawn. Thanks for joining us.
Thanks for having me.
Before we jump into the interview, I want you to tell our listeners about what your current professional role entails with the Mississippi Hospital Association.
I am the Vice President for Communication and Member Engagement. I slowly started to do more health equity work just because I got my doctorate of health administration in 2021. And that was my focus for that. So a lot of times people are like, what does communication and member engagement have to do with this work? But that is how I kind of slowly got into more of the health equity space.
Very, very interesting. I love to hear that as someone that does a similar line of work. That's really cool. So, Shawn, I want to also ask about, just so our listeners can get to know a little bit of the personal side of you. Tell us something interesting about you that a fact that might not show up on your CV.
Well, I do. I'm a water baby, so I'm guessing I like paddle boarding and kayaking and canoeing. I like to be outdoors in general, but especially near the water. I grew up in Biloxi, Mississippi, and I think that I guess growing up near water, you kind of seek it in any form as you get older, no matter where you are, even if it's an inflatable pool. So, yeah, that would be my fact, my fun fact.
You recently attended the AHA Health Equity Conference. So, just for our listeners, can you give a little background on what that event's all about for those that might not be familiar?
Yeah, it was my first year to attend, and it was very exciting. There was over 900 attendees and like 30 sessions covering different topics. And in March, I always attend the American College of Healthcare Executives meeting, and that is kind of various topics, health equity being one of them. But this is interesting because you're really focused with just the people working on the same issues that you are. So all of that camaraderie and grousing and how are you doing this and all of that it really helps as far as the speakers, but also just the networking. Yeah, I recommend the conference to anyone who's working in the space. It gives you a lot of inspiration to go back and do the work you need to do when you get home. So.
That's great. And is that a meeting that travels around a little bit, or is that in a set
Yes,
location?
it was in Minneapolis, which I
Okay.
had never been to. And I would not have imagined a Mississippi girl would like a snow state, but it was great. I mean, it was not snowing. I will say that it was not snowing at the time, but Minneapolis was a neat city. The conference, interestingly, Dr. Ivor Horn, who's the chief health equity officer at Google, is from Jackson, Mississippi, and she was one of the speakers. I did not know she was from Mississippi, so I felt like I had a hometown connection even there. So
That is really awesome. Did you get a chance to meet her or no?
yes, I of course had to go up and
Nice.
say, I'm from Mississippi. And she was very gracious and took time to talk to me. So
That is really cool. So I want to know about the work you're doing to help organizations prepare for the new CMS and Joint Commission requirements on reducing healthcare disparities. Tell us about that.
yeah. Well, at the Hospital Association, we've been having webinars to help our members because it's really a list of requirements and some overlap, some are similar. So, like on the CMS side, they start later than the Joint Commission requirements, but not all hospitals are Joint Commission certified. So, those that were had to get a quicker jump start because they needed to get ready by January 1st of this year. The CMS requirements are similar to other requirements that at first they just want you to do it, but then eventually they start biting the carrot and the stick approach, where at first they try to entice you and then they start penalizing you if you don't do it. So they're both really focused on different things. The Joint Commission is looking at health equity as more of a quality improvement project, and they want those people working on those issues to look at it in that vein. And the CMS is really focusing on getting hospitals to collect more data, to do those health screenings on those social health related social needs, and to get them in the electronic health record. because right now a lot of this data is anecdotal and found in notes and different areas like that. And in order for you to be able to compare yourself across hospitals, across states, of course, you need the data to be standardized in order to be able to make comparisons. And it's exciting just because we're in such a new phase of all of this, and there's so much to do. And there's so much work just in trying to figure out how this plays into the strategic planning process. But I do think that many of the members that work on it are excited because if it's a compliance requirement, it frees up mental headspace and trying to convince others that it's important. So I think that has helped in that vein. But I do think there's still a lot that needs to be done in focusing on the business case, return on investment, making sure that it is all lined up and it's not just meeting a compliance requirement. Because as we know in healthcare, it gets very easy to just check a box and say you've done it without doing much of the mental head work beyond that. So
that is great information. And now, the name of this show is Healthcare Experience Matters. And of course, patient experience and learning about how that can be elevated is a huge part of why we exist. So just tell us about how you see health equity work tying into patient experience.
Yeah, I mean, for me, the first tenet is trust. A lot of what patient experience professionals are building on is how to convey that trust with patients. And a lot of this health equity work is grounded in trust, and trust in that you're going to be treated well when you get to a healthcare institution. Trust that the care is going to be available, that you need it at the right time, at the right place. But on the experience side too, apart from trust and kind of diving into those unconscious bias things that can be found everywhere in any, exploring those avenues, diving into the HCAHPS data and stratifying that data by like race, ethnicity, English as a second language, and really kind of it's interesting to focus on that as work on health equity, because a lot of times when you look at hospitals' patient satisfaction scores as a general, and you're not looking at stratified data, they have pretty high scores. But then when you start diving in to the particulars, you kind of see the areas that you really need to work on. So yeah, that has been interesting, because I think as a first step, just collecting the data and getting used to looking at it in general. But I think there's a crew of people now that are starting to dive into that data and use it as the basis of their health equity work. So that's been interesting.
This has been a great discussion. I'm actually really excited to get this one out to our listeners. We're talking about some timely current event type things here. So before we wrap it up, Shawn Rossi, I'm going to give you the final word. Just any other final thoughts for our audience that might be valuable?
Well, and I mean, assuming I know that you have many more listeners than just healthcare experience professionals, but for those that are out there, I really do think if you do not have a seat at the table in this health equity discussion, now is the time to go demand one, because you are an integral part of all of these discussions. And if it is being handled in like a DEI department or a quality improvement department or some department where you're not seeing collaboration, and you're not involved in that collaboration, I think now is the time to go and explain what you can bring to that table. So that's what I would leave with.
That's a great nugget to finish with. We've been talking to Shawn Rossi. She's the Vice President of Communication and Member Engagement with the Mississippi Hospital Association. Shawn, I really thank you for your time today and all this insight.
Yeah, thanks for having me. Appreciate it.